Welcome to the Ask Dr. Tommy O Show. The Ask Dr. Tommy O Show takes a holistic approach to our community's healthcare needs and concerns. Today's show is called Welcome to 2011. I'd like to introduce my guest. He's very proud. He's like I always tell everyone he's like a father because he treats me like a son. We have a nice, important, and close relationship. Well, welcome to the Ask Dr. Tommy O Show, Bishop Burkett.
Right. Well, this is great. This is an unusual show, folks, because we're going to be talking about a number of things that are interesting and important for all of you that are watching. And we've done so many wonderful things. Dr. O'Brien, my doctor, by the way, and certainly the physician of the church, we've done some wonderful things in meeting the needs of God's people. And so we're going to be talking about the Golden Gloves. We're going to talk about Medicaid, Medicare. We're going to talk about some things that we're going to happen right here at Church Alive. So you stay right with us. This is going to be very informative, a very high tempo, and maybe you need to have paper and pencil ready because I know there's a lot of things you're going to want to write down. So it's not my show, Dr. O'Brien.
It's our show.
Right.
It's how we work as a team.
Yeah.
We always say it's the God Squad.
Okay.
Working as a team together.
Now, first, you'll tell people about our YouTube because we're on YouTube, and folks, you know, I had a lady call me all the way from Oklahoma. She said, and then one lady called me from Nigeria. She says, I saw you on the YouTube, on Dr. O'Brien's, Dr. Tommy O's YouTube. You know, she's been talking to me on the phone, but she never knew what I looked like because of you.
Okay, see, that's important.
So tell us about the YouTube.
Yeah, sure. Why don't we give that information out? So if you like to see past shows with the Bishop and I, all you have to do is go to youtube.com and then you type in Dr. Tommy O or Ask Dr. Tommy O, Community Health Education, or Dr. Thomas G. O'Brien within this search, and you'll see a list of my shows will come in. We'll also give you, we'll type on your screen a direct link to my channel, and you'd be able to, you know, just click the button, pick a show, and watch it. So you have different parts. The older shows, there's 3 parts because we had to split it. But now with the new regulations, because I've been approved where most of my shows will be 2 parts because I can upload at least 15 to 20 minutes now. So that's pretty exciting. So youtube.com, you can type in Dr. Tommy O or Dr. Thomas G. O'Brien or Community Health Education. That will bring up the list of my shows.
Well, this is the season for the Golden Gloves.
Yes.
And I know you play an integral part in it, a very important part.
Yes.
Tell us about the Golden Gloves.
Okay, yeah, Golden Gloves. Well, the Golden Gloves is a tournament that started 70, 80, I'm going to say 84 or 85 years ago. It's right around there. I don't remember the exact date, but about 84, 85 years ago. Everyone thinks it started here in New York with the Daily News, and it started in Chicago, and then we picked it up. So it's a tournament that's held by the New York Daily News, and it is 8 weeks long, about 8 weeks long. We start with the physicals, January, the first week of January, first 2 weeks of January, and we screen all the participants, the boxers. We don't say fighters. You fight in the street. These guys are boxers because they are trained. And then we start with the tournament itself, and we end with the finals at Madison Square Garden. So it's pretty exciting.
Well, you still didn't tell the people what you play in
my role.
Right,
yes.
yeah.
My role. Well, I am a ringside physician through the United States Amateur Boxing Association, and I'm part of what we call the Metro, and that is the Metropolitan, and that is all of New York, Long Island. So that's Suffolk and Nassau County, and all 5 boroughs of New York City, and we also extend up into Middletown, Newburgh, Poughkeepsie area. So that is part of the metropolitan, what we call the Metro region.
Now, from what I understand, you play an important part of whether the boxers are ready to fight.
Yes.
Whether they're fit mentally, and even when they take a punch, whether they're in danger. Tell us about that, because I know that that's a determining factor in whether people win or lose or disqualify.
Exactly. Yes.
Yeah.
Well, the Golden Gloves, they're very strict because we have, like I said, the United States Amateur Boxing Association, the judges and refs. It's part of it. It's not what we call a smoker where you just come off the street and you start swinging. We're very strict. that we reference that you have to follow. There's rules and regulations. As a physician, my responsibility as a ringside physician, I will perform the history and physical before the tournament begins, and they must be screened out. They must be approved before they can move on to actually fight. Then on the night of the event, before they even enter the ring, we do a physical again. Just because they pass the physical at the very beginning in January, anything can happen between the initial history and physical to when they first start fighting, because these guys are still training, and they're still in their gym, and they're getting hit. So if a week or 2 weeks go by from the initial history and physical, they could have been knocked out, and they don't tell anyone. You know, something neurologically can go wrong. They can break a bone. Some guys, you know, they have these orthopedic injuries, and they still want to fight. And my responsibility is to make sure they are health and safety. They must be healthy, and I have to protect their safety before they can enter the ring and
Had you ever experienced where you had to tell a fighter, you're just not ready to take a punch?
Yes. A lot of times, blood pressure's too high, or they had an orthopedic injury and they must have a medical clearance by their orthopedic or their primary care physician. That is my responsibility as a physician for the United States Amateur Boxing Association, as well as my state license. My state license, that is the governing body. And my license gives me the ability and the authority to say you can fight or not.
But that's really something important, because a lot of folks don't realize that the fighter is not just put out there to get banged around, and it's whether or not they can handle it, whether they're fit for it.
Yes,
that's
well,
important.
Getting to that is we have professionals. A lot of our judges were former Golden Gloves, or they were professionals, and they are trained. They go and they get certified. The gyms are certified. Everyone's certified. You must be certified, because then there's a certain level of expertise, a minimum level of expertise, and everyone has extra training so that their level of expertise is higher than the minimum standard. To reduce the risks of injuries, we try to line up the boxers with skill level. We have amateurs and an opening. We don't have those fighters that are open status fight an amateur who's has no experience at all, because they're not at the same level, and that's where injuries can occur. We also go by weight class, so that we're very strict within the weight. You must be within your target weight, your weight class. Each round we're allowed to be X amount of pounds over, but it's very strict. It's not a lot, and then each round we get tighter and tighter, and that's to protect the boxer himself. You don't want to match up someone who's 10 or 15 pounds heavier than the opponent, because there is a difference in the velocity and the punch. Because then you can get into physics, where you're going to have that the power behind the punch. So we try to match up each boxer as close as possible, and that will reduce the risk of injury.
Well, these are things that people don't know. They just think they're out there beating on each other, And like you said, they're not fighters, because that's another. They're boxers.
They're boxers.
Yes. While you're thinking about the Golden Gloves, the church is also concerned about the health and wellness of all of our congregants and the community. So we're having on March the 19th, folks, a Health and Wellness Day. And on that day, as it was last year and the years before, Dr. O'Brien is there. He comes in and he talks about health. We do a diabetic screening, and we also give people information as to what to do if they have it or to prevent it. We also do a blood pressure testing, and this year also we're going to do something in the area of prostate cancer, because a lot of men need to get screened early on. And then HIV/AIDS, and it's simple tests that all of us should really test it, especially those who have any kind of sexual contact with whether it be male or female,
Right.
They need to do that. And Dr. O'Brien, I'd like to say something a little bit about HIV/AIDS and the importance of people being tested early and not just taking it for granted. But we're going to have it on March 18th. We need a lot of volunteers. We're giving out food packages and clothing. We're going to have a great day here at Church Alive, and we want you to come and be part of what we're going to do to holistically meet the needs of God's people.
Absolutely.
HIV/AIDS.
Yes, yes.
Okay.
Well, since the church is here and you're the Bishop of the Bronx.
Right, right. That's what they call me.
That's right.
Right.
Unfortunately, the Bronx is the leader for HIV, and we've said that it's been documented, it's well known, and it's also been documented that the Bronx is the unhealthiest borough in all of New York City.
Unfortunate, yeah.
It is unfortunate, and you know our part here is as the minister of the church and minister of medicine, if you will, because I've been called that.
That's right.
Is to educate and enrich the community on how to improve their wellness by offering shows and community outreaches. We do the health screening, and as you just stated, we bring a medical team in and we check for blood pressure. I don't know how many times we had blood pressure readings that were hypertensive, and the patients, you know, like patients, but the community members, they had no clue. And I said, well, have you been having headaches and change in vision, or when you're laying down at night, you're hearing a little sound by your ear, or behind, you know, some pressure behind your eyes? Like, yeah, I thought that's normal. And I'm like, no, you need to see me, or you need to go in to, you know, set up an appointment with your primary care physician. This happens not quite frequent and too often, unfortunately. Also, we do diabetic screening, where we do a finger stick and we see what the blood sugar is. And we're seeing patients, again, community, I call them patients, but community members, and their blood sugar readings 400 and 500. You know, okay, it's a one-time reading, and you know, but still, with a reading that high, you really have to say you need a thorough physical, a history and physical. We have to do blood work. We have to do a hemoglobin A1C and see, because that's the new standard where we're using that to define diabetes. Where if the hemoglobin A1C is starting to, if it's not starting to be, but if it's elevated above a certain number in a cutoff, we like to see everyone below 6.5. And so if your hemoglobin A1C is 7, 8, 9, 12, I had a patient, this time it was a patient that came in, hemoglobin A1C was 19.
Right. Boy.
Now, by the time I started treating the patient, 3 months later, I had that hemoglobin A1C down to 13, and another 3 months later, I had them down to about 9, and a year later, their A1C was in the 7 range. But there was a lot of compliance, a lot of education. The patient trusted my skills and my knowledge, and the patient followed my instruction, and that's with a compliance, and that's why I saw such a drop, because when I go away on my conferences from my continual medical education credits, because I have to maintain credits per year, when we speak about diabetes and hemoglobin A1C, a lot of physicians, they have difficulties with dropping that A1C just 1 point, and I say just 1 point. I'm able to drop, you know, several points, and I guess I contribute it to the amount of time I spend educating my patient. Educate, just like what we do here on both of our shows, and on Sunday, and when we're in the streets and we put on our outreaches, it's all about education, it's knowledge. And for everyone who sees me on Facebook, and so I'll give a little plug there for Facebook, but my friends in Freeport High School, class of '82, and everyone from Freeport High School, I love you guys. All right?
I want to ask a question. On the 18th, when we do the Health and Wellness Day, is it possible to do screening there for cholesterol? Or do we have to send them to the clinic? Yeah,
they would. I know we have a finger stick for cholesterol, but I don't know how accurate that is. And we've tried it, but the best is to have blood work drawn within the clinic or at a local lab.
Right. Well, I know since you've been looking over this pastor, this bishop, my cholesterol level has really been dropping. I mean, when I first came to you, it was about 255. And now it's down to about 203.
Yeah, it's low too.
Yeah. So, you know, and it's really educating me.
Right, but it's not medication. Right, it's not.
No, it's not medication.
It's not medication. It was just diet and modifying your diet, increasing your fibers, and compliance. And remember, knowledge is power, and that was the point that I was getting to, because whenever I type anything and put information out there, I always say knowledge is power.